Perfect. All right. So my name is Danish Khan and I work at HTA as the product manager, which basically means that all of the products, basically the programs that we offer are developed by me and my team. And I will be talking about each of those programs in detail today in this webinar. As I share my screen, I would like you guys to get familiar with the Zoom if you guys are not familiar with it already. We have a question answer feature that you guys can use. If that is not available, then the chat feature should be available for you guys. I will suggest that you guys use the chat whenever you guys want. However, if there are any questions which might have some discussion, I would request you to keep those questions towards the end because we will have about 10-minute session at the end for question answers. But if there is something which is relevant to what I'm covering during the webinar, I'm more than happy to answer. I also have a few team members who are here and they will be able to assist you with the questions that you'll be asking as well. So starting off with the Health Tech Academy's introduction. So HTA is an online training provider that offers different training programs for people who want to work in the allied healthcare space. We currently have more than 1,500 students that are enrolled in one of our programs. We have more than 25 coaches that are there to help the students one-on-one. So if you're enrolled in any of our programs, you will be eligible to receive one-on-one coaching sessions with the coaches who have the relevant experience in the field that you want to work in the future. We have more than 10 on-demand boot camps. They're on demand because if you enroll today, you can start from tomorrow, and it's completely self-paced. Then we have 100% student placement rate for the students who have actually completed their program. So if they're completed the program, passed the certification exam, all of them till now have been able to secure a placement. Our headquarters are in Austin, but our team is based all across the US and abroad as well. Just to reiterate, make sure that you're familiar with the chat box or with the question answer feature to make sure that you're able to engage with us. All right. So just so you guys have an idea about what is happening in this webinar today. This is an overview. We are going to talk about HTA a little more. I've given you guys the basic introduction. Then we will talk about the future of allied healthcare, which is very important for you to understand, because if you want to work in this sector, it's useful to know what is coming up next in the next few years. Then we're going to talk about the boot camps that we offer. I'm going to cover each of the boot camps. I'll try to keep it short because there's a lot of information which is repetition. So I will leave that information and make sure that I'm talking about the things which are different in each of those programs. Then I'm going to talk about the admission process. How is it going to work? Then we have quite a few financing options for you guys. You can pay up front and have a discount, and quite a few other options that we have available. So we're going to talk about that. We have a few funded options available as well. And for that, I have my colleague Chester joining us today, and he will be covering that towards the end of the session. Then I'll be talking about the career services that are offered here at HTA. We will hear from some of our students. So we have some student testimonials, and then we will end the webinar with a question answer session. So let's move on to the next part. So who we are and what we do, we have over 20 years of experience. Our team comes with over 20 years of experience in the ed tech space, and our team has more than 15 years of experience when it comes to healthcare and offering different healthcare training programs. As I shared, we are headquartered in Austin, Texas, and HTA aims to transform the healthcare education and staffing. We focus on excellence, innovation, and personalized learning, and all of our programs are flexible to make sure that they can fit seamlessly into your schedule. So it doesn't matter what you do, if you are studying at the university, or you are working somewhere else, or you are a full-time mom, doesn't matter. You can still complete our program in about 4 months. Most of our programs can be completed in 4 months. Here is our vision and mission statement. I'll give you guys about 5 seconds to just go over it. It's pretty similar to what I've shared already about HTA. And so in terms of our boot camps, we partner with different industry experts who help me build the content and make sure that it's aligned with the regulations and with the requirements of the certifying bodies. We have different universities that are on board with us. We work with different employer and healthcare partners to make sure that our programs are able to serve the purpose that they have. Our programs have different courses. Each program has different courses. Each course has different lessons. Every course has course exams. Every lesson has lesson quizzes. It's there to make sure that everything that you're studying, you're able to understand it. We have ebooks and a lot of other supplementary material that is available as part of the program as well. As I told earlier, the program is on demand, so you can start whenever you want, and whenever you start, you can complete the program at your own pace. If you want to, spend a couple of hours in the morning, you can do that. If you want to spend a couple of hours around the midnight, you can do that, because it's completely self-paced. And we offer one-on-one coaching sessions for anybody who wants to speak to to an industry expert, and they want to ask questions about the content that you are studying, or if you are just curious about the kind of opportunities that you will have if you complete this course. So you have 5 one-on-one coaching sessions that are available for you with our coaches. So some of our partners, these are very few of our partners, and some of these are certifying bodies as well, the universities, and you can see rest of our partners list on our website. I think I've covered the flexibility of our program already, but just to make sure that you guys understand it, the programs are designed for all kind of experience levels. So if you are a beginner who has very limited or no healthcare background, most of our programs are suitable for you, except a very few. I'll be talking about those programs where we do recommend that you have some kind of healthcare background. You don't need to relocate in order to complete any of our programs, and our training is available 100% online. But remember that it is the training that is 100% online. Of course, if the programs require you to do certain number of hours as clinicals, they would require you to go into the field. However, that is just required for 4 of our programs, not for all the programs, and that's just for the clinical part. But the learning part is all done online. All right, so that takes me to the end of the first part. And the second part is basically talking about the future of allied healthcare. And with that, I would like to, pose this question to the attendees that I see here today. I want you guys to think about the most you can say the most futuristic opportunity or most futuristic feature that you have seen in the healthcare space, and the kind of service in healthcare space. What is that one thing that has really fascinated you, and you have thought that, oh wow, this is absolutely futuristic, and it can really help more people with their health needs. So have you seen anything like that? I would like you guys to use the chat box, share your thoughts about it. And while you guys do that, I'm going to share some of the things that we have come across. And that is, first of all, I think it's very important for us to establish that allied healthcare roles are in a very high demand. They have been in high demand for years, and they will still be high in demand in future as well. Now, a lot of us can assume that because there's a lot of integration of technology, a lot of innovation is happening in the healthcare space, so that might result in lesser number of allied healthcare professionals needed in future. But that is not the case, because as we move forward with the technology, you will need more people to use the technology. The eventual the eventual goal is to help more people, and that will happen. It's not that your jobs would be no longer available. They would still be there. They would change. They will evolve at a fast pace, but they would still be there. It's very important that you understand that, and with that innovation that is happening, you stay up to date with it. Now, if you want to be relevant to that future of allied healthcare space, the best way you can do it is start in the allied healthcare space in one way or another, start with an entry-level position, and most of the programs that we offer lead to entry-level positions, and that's how you can stay relevant to that future of allied healthcare. If we talk about some of the trends, you guys can see some examples that I've written over here, but I think one of the things that really fascinates me personally is robotic assisted surgery. I think that is going to be the future. A lot of these surgeries that are done, they are going to be done by the robots, and they are going to be way more efficient with the delivery that they have to do in terms of everything that they have to perform. And I think that that is very fascinating. And then there's a lot of automation that is happening at different places in medical assistance, in pharmacy technology, in sterile processing techniques. A lot of automation is happening, and that is all going to be there, and it's going to evolve. A lot of new trends are going to be seen in this allied healthcare space, and you guys can stay part of it, or you can become part of it, learn these different new features that are there with the new technology, and then grow in your own roles. So now let's just talk about how you can, what is the opportunity that we have for you that can help you start your career in the allied healthcare space. And in this section of our webinar, which is going to be the longest part of the webinar, I'm going to talk about different programs that we have. As I shared earlier, there's a lot of information which might be repeated for all of these programs. I'll try not to repeat it, and I will refer you guys to our website for the information that you guys need further. So starting off with our surgical technology program, which is offered through NCCT. I mean, we offer the program, but it leads to the certification by NCCT. It's called Tech in Surgery Certification by NCCT, and you can complete our online training program in 16 weeks. Now, please remember that this 16 weeks, as I said earlier, is just for the online training program. That doesn't mean that in 16 weeks, you'll be ready to start a job. For this program, that's not true, because after these 16 weeks, you will be required to do your externship. Your externship for surgical technology requires you to complete about 125 surgical cases, which can take any time between 6 to 8 months to complete. But that clock starts, 6 to 8 months clock starts from the time when you have secured the externship, and securing the externship is another 3-4 months, because it's a long process. So you can imagine that for surgical technology as a role, it is a long process. However, if you compare it to the traditional colleges that are there, that are offering different training programs in surgical technology, those learning experience itself is maybe 1 year or more. So that's why this program is way shorter than that. We have a lot of programs where you can do the 16 weeks course, sit for the certification, and you're ready to work in the industry. So tuition fee for this program is $3,450, and we have different monthly payment options starting from $266. And we also have bi-monthly options where you pay every 2 weeks, or you can also pay weekly. So we have those options available for you as well. In terms of eligibility, you need to have high school diploma or GED qualification, or any kind of equivalent qualification in order to enroll in this program. You need to have internet. You also need to make sure that you know how to navigate through different online platforms, and you can browse on internet. So that's a requirement that we have in terms of the eligibility. Now, for this program, which is surgical technology, although it does not, like the certification does not require you to have healthcare background or experience. However, when it comes to finding externships or finding placements for this role, you do see a lot of employers asking for some kind of healthcare background, which makes it difficult for the students who do not have any kind of healthcare background to find jobs. So that is something that we would highly encourage, that if you're interested in surgical technologists and that's your goal, that's your dream, we would suggest that you start off with another role where you can get into the job market straight away. Like for medical assistant, you can just start working as soon as you're done with the certification, which can be in as low as 4 months. Then we would suggest that you go on that route and then come back to surgical technologist certifications. But that's very much up to you. That's just a recommendation from our side. In terms of the offerings, the program includes a self-paced online course, and we have one-on-one coaching sessions, which are 5 one-on-one coaching sessions. You have a certification exam preparation course. So once you're done with our online program, you have a self-assessment by NCCT, which you can complete to see where do you stand before actually sitting for the actual exam. So that is very useful because it's an official exam prep course by NCCT that is included in the price that you pay to HTA, $3,450. Then we have Career Sport, where you get 2 career advising sessions where the career service advisors are there to help you throughout your journey of finding an externship site or finding a job. Then we have our ebook, which is included in this cost as well. You get a few skills videos where you can see how to really perform certain procedures or how to assist while certain procedures are happening. And the exam voucher is also included as part of this program, as part of this cost. Now, one thing that you will see in a lot of these programs that I'm going to talk about is the restricted states. Restricted states are the states where this program is not available because of the state's regulations. So if you are in one of these states, please make sure that you do not enroll in this program. And remember that these regulations are always changing. So I would suggest that before you enroll into the program, go to our website, click on About tab, and under the About tab you will see a drop down of state restrictions. There you can go to that page and add your state, and you can see all the programs that are available and all the programs that are not available in your state. So I would highly recommend that you guys do that. If you need more information about this program, or if you want to see the whole syllabus or the curriculum that we cover, you can download the syllabus by going to our website, open the surgical technologist page, and you will be able to see rest of the information. All right, so let's jump on to our next program, medical assistant. So surgical technologists, I told you that 16 weeks is the duration that you need to complete the online training program. For medical assistant, you can complete everything in 16 weeks. So basically in 16 weeks, you can done with your online training program, but at the same time, you can also get done with your certification exam. You complete your certification, you are fully certified as soon as you're done with your certifications. You don't need to step out of your home in order to complete the certification. You can step out once you have a job. And that's, of course, not something which would happen in all the cases. Sometimes you would need to go and go to different healthcare providers, different healthcare institutes, and see if they have job openings for you. However, there's no requirement for externship, and you can complete the program in absolutely 4 months. But of course, it depends on your pace. We are assuming that you're spending about 15 to 20 hours a week. If you spend more, you can complete the program sooner, and you can also sit for the certification exam sooner. The tuition for this program is $1,250. That's one of the programs that is pretty much subsidized. If you go onto our website, the actual cost is $2,700. We are subsidizing this program quite a lot, and the weekly payment options start from $49. We also have payment options of bi-monthly payments where you pay $98 every 2 weeks. The eligibility criteria is the same. The offerings are the same, except that there are no coaching sessions and no exam voucher that is included in this bootcamp. However, if you're interested in doing coaching sessions, and if you're interested in having the ebook, ebook is of course included in this one. If you're interested in having the exam voucher, coaching sessions, exam prep course by NHA, all of that, then I would highly recommend that you go to your admission advisor and you tell them that you are interested in that program. That would have a higher cost, and you can absolutely enroll in that one. But if you don't want to pay that much, then this is a great option for you, because you get the same content, you still get the career services support, you get the ebooks, and you get the skills videos. So there are 2 restricted states here. I think this was not updated. As of now, there are more states where the medical assistant program is not available. So again, I would recommend that you go to the website, and you go to the state restrictions tab, and add your state and see if the medical assistant program is available in that state or not. Patient care technician, the program is pretty similar to the medical assistant program. However, this one is not subsidized the way medical assistant was subsidized. The eligibility criteria is the same. The tuition is similar to the surgical technologist program, and we have different monthly payment options, bi-monthly payment options, and weekly payment options as well. The offerings are the same. You get one-on-one coaching sessions where you have 5 one-on-one coaching sessions for this program. You get the certification exam preparation course, which is an official certification exam preparation course by NHA, where you can have some practice tests done. You can review most of the content just to make sure that you're aligned and you're absolutely ready to sit for the exam. And the exam voucher is also included in this cost. The restricted states are 3 as listed here, but this might have updated as well. So go check it on our website. If you want to download the syllabus or the curriculum, go to the website, click and go over the content there, and you will be able to see the download syllabus option on the website as well. Pharmacy technician certification. So we offer 2 different pharmacy technician certifications. One is certified pharmacy technician by NHA, and the other one is certified pharmacy technician by PTCB. Now, both of these programs, the PTCB one and the NHA one, have pretty similar content, and you can enroll in both of them. But the NHA one is usually considered for more entry-level roles, and the PTCB one is considered for slightly advanced role. I wouldn't say that those are advanced roles itself, but slightly advanced as compared to these roles, the ones that are offered to you after doing the NHA certification. But the content is pretty similar, and you can complete it in 16 weeks. The tuition is pretty similar. Eligibility criteria is pretty similar. You don't have to do any kind of clinical hours. So again, what I said for medical assistant, I will say the same. If you start this program, you can absolutely complete it in 16 weeks, and you can sit for the exam. And whenever you pass the exam, you're fully certified. For any programs where you do not have any kind of clinical requirements, you are fully certified as soon as you are done with your certification exam and you have passed it. But for other programs where you have the clinical requirements, there you have to complete the clinical requirements, and only then you are considered fully certified. And for that reason, we do recommend that if you are going to enroll in a program where clinical requirements are there, for example, surgical technologist is a program where you have clinical requirements, we suggest that you complete the online program, you go complete your externship hours, which would take about 6 to 8 months at minimum, and then you sit for your certification exam. And the reason for that is that through your practical experience that you are doing in your clinicals, that really helps you with your exam, because you have learned a lot more things while being there in the surgical rooms, and you have seen the whole process yourself firsthand, not just theoretically. So we do recommend that you complete your clinicals before sitting for the exam. Pharmacy technician program does not have that requirement, so just bear that in mind. The offerings are the same. You get everything as part of this program, and here are some of the restricted states. Again, this might be updated, so go check the website. The PTCB certification program is widely accepted all across the US. It has much more preference as by the employers for the pharmacy technician roles. And we are also a PTCB approved institute, which is which I believe is a great honor for HTA. And the program is pretty much the same as the NHA one. And the restricted states here are, I think, similar to what we have for the NHA program. So please bear in mind, this is not correct. All right. So moving on to our dental assistant program. So we offer a dental assistant program, which is registered dental assistant by AMT. And we are, of course, partners with AMT to offer this program. It's a 16 weeks long program. The tuition is $3,450. We have different monthly payment options, bi-monthly and weekly payment options as well. Eligibility criteria is the same. Offerings are the same, and the restricted states are there as well. Go check out the restricted states page on our website just to make sure that these are up to date. One thing that I can tell you about our dental assistant program, which is very interesting, is that this program has been, and this is just the limited experience that we have with our students for dental assistant. Bear in mind that most of our students are either enrolled in surgical technologist, medical assistant, medical billing and coding. We don't have a big number of student population studying in dental assistant. However, the ones that have completed their dental assistant program All of them are working straight away. It was a lot easier for them to find jobs. And this is just a limited experience, but I can tell you that there are a lot of dental assistant roles that are out there, and you will be far more likely to find a role sooner as compared to rest of the programs. So I would, I would say that dental assistant is a good option to consider. Then we have our sterile processing technician program. Till now, before sterile processing, till dental assistant, all of the programs that I've covered, only surgical technology requires clinical hours. Rest of the programs do not have any kind of clinical hours. You can absolutely complete the program in 16 weeks or less, and you can pass the certification exam. For sterile processing technician, however, it's the second program which requires the clinical hours. It's the CRCST certification through HSPA. We are, of course, partners with HSPA to offer this program. The tuition for this program is $3,450, and we have different monthly, weekly, and bi-monthly options to pay. The eligibility criteria is the same. Offerings are the same. And the best part for this program is that there are no restrictions in terms of the state. But there is externship requirement. So you have to complete 400 clinical hours, which on average takes, again, about 6 to 8 months for you to complete those requirements. If you want to sit for the certification exam before completing the clinical exams, you get the provisional certificate, which is not going to be useful until and unless you complete your clinical hours. And that's how you get your full certification. So for this program as well, my recommendation would be complete our online program, sit for complete your clinical hours, and then sit for the exam, because your clinical hours and the practical experience you get out of it would absolutely be beneficial for your practical exam. Your actual exam that you'll be giving for CRCST. A lot of the students who are interested in surgical technology, but they do not have any kind of background in the healthcare sector, we do recommend them to get into sterile processing as a field, because you work way closely with the surgical technologist as part of this role, and that can be a pathway to get to becoming a surg tech in future. And it's a little easier for you if you do not have any kind of medical background. It's easier for you to find sterile processing externship options or sterile processing placements as compared to surg tech placements. Again, you can download the syllabus from our website. Phlebotomy technician. So rest of the programs that I've covered till now, apart from medical assistant, were all priced at $3,450. Now we are going to talk about phlebotomy technician, where you have $2,000 is the cost of the program. The duration is shorter as well. It's 12 weeks long. The certification is Certified Phlebotomy Technician, CPT, by NHA. The eligibility criteria is pretty similar, and we have different monthly payment options and also weekly, bi-monthly payment options available for you guys as well. Offerings are the same. So you do get one-on-one coaching with it. You do get an exam voucher for it. You do get certification exam preparation course with this program as well. There are a few restricted states for this program. And very importantly, this is the third program that also has the externship requirements, the clinical requirements. So you have to complete certain number of clinical hours, but those are very, very the number of hours that you have to do is much less as compared to the ones that you have to do for surg tech or sterile processing technician. So go to our website and you can find more information about the number of hours that you have to do for your phlebotomy technician clinicals before you sit for the exam. And those are required by NHA in order to give you the full certification. So the next program is Medical Billing and Coding, which is Certified Billing and Coding Specialist by NHA. This program is a 12 weeks long program as well. However, the cost of this program is $3,450, and the monthly payment options are starting from $266. Again, we have weekly and bi-monthly options available as well. The eligibility criteria is the same. Offerings are pretty much the same, and there are no restricted states. So that makes this program one of the high demand programs here at HTA. However, one thing that I would like to mention here is that when you complete this program, medical billing and coding, you are going to be eligible for most of the medical billing roles. You are not going to be eligible for medical coding roles, because medical biller roles are the entry-level roles. Medical coding roles are a bit more advanced, and you do require some years of experience in order to work as a medical coder. So if you want to become a medical coder in future, for example, you can start off with medical billing and coding certification, CBCS, which gives you a very short introduction to coding, but it gives you much more detailed understanding of medical billing. And that's how you're eligible for most of the medical billing roles. And after that, if you want to do medical coding, you can do, and we offer that program. Or if you already have some years of experience in the medical field, you can enroll into our medical coding program as well, which is offered through AAPC. It is CPC, the certification, which is certified professional coder certification by AAPC, and it's a 14 weeks long course. You have to pay $3,450 as the upfront, and if you want to go with the monthly payment options, you can pay about $266, and we also have bi-monthly and weekly options. Rest of the things are the same: eligibility, offerings, and there are no restricted states for this program. So we have 4 more programs to go. Then we have healthcare IT, which offers 2 different certifications: ITF Plus, IT Fundamentals Plus by CompTIA, and CEHRS by NHA, which is Certified Electronic Health Record Specialist. This program is 16 weeks long. And the cost of this program, because it's 2 different certifications, is $3,950. And the eligibility is the same. The offerings is the same. However, because it's 2 different programs, you get 2 exam vouchers and you get 2 ebooks, which I think is a great offering. And that's how we justify the price, because it's a bit higher than rest of the programs. But you get 2 different certifications, and there are 4 states where this program is restricted. So make sure you check that out from the website, confirm it, and only enroll if the program is available in your state. One very important thing about this program is that if you want to work in the healthcare information management field in future, or you want to do the KHIMS certification, this program is a great way to start with that, because it allows you to learn basics of project management, basics of data analysis, and a lot of other things. So you not only get the CompTIA and NHA certifications with it, you also get the foundational level knowledge, which is not really required for ITF Plus or CEHRS certification, but is definitely required if you want to work in the healthcare IT field. And that can prepare you for your future certifications that you will have to do in that field. Medical Health Record Specialist is one of the certifications that we offer as part of healthcare IT program, but we also offer the medical electronic health record specialist certification separately as well. It's a 12 weeks long course, and the upfront fee for this course is $2,000, and you can pay monthly, weekly, or bi-monthly as well. Eligibility is the same, offering is the same, and the restricted states are of course the same as healthcare IT program as well. But bear in mind, for this program, of course, it's just 1 certification sheet, so you only get 1 ebook and 1 exam voucher, and what you get rest of the things the same. Electrocardiogram technician, which is EKG. It's the CET, Certified EKG Technician certification. It's not EKG, it's Certified EKG Technician by NHA. It's an 8 weeks long program. The cost is the same as Electronic Health Record Specialist. Eligibility is the same. Offerings are the same, and there are no restricted states. This program is our 4th program. So starting off with Surge Tech, then sterile processing, then phlebotomy technician, and now EKG technician. This is the 4th program that requires clinical hours, but same as phlebotomy, those clinical hours are very, very small in number as compared to Surge Tech and sterile processing. So go check out the website and see more information about the clinical hours. And of course, it's easier to find clinicals for EKG or for phlebotomy as compared to surgical and sterile technician clinical hours. So that's our second last program for the night. And the last program that I'm going to cover today is healthcare leadership, which is a certification that we developed in-house. So you get the HTA certification for it. It's not offered by another certifying body. It's a 12 weeks long program. Everything else in terms of the criteria, offerings are the same. There are, of course, no restricted states. And this program is relevant for anybody who wants to learn some leadership skills, who wants to see themselves as a team manager in future, and you want to or you're already a manager and you want to learn some basic skills, that this program can be very, very useful for you. I've already covered the pharmacy technician CPHT by PTCB, so I'm not going to cover that again. However, I will say one thing for you guys before I move on to the admission process, and that is that if you go onto our website, you will see 3-4 more programs that are listed on the website, which are primarily the same programs, but they're bundled together to make it more cost effective. So we have clinical medical specialist. We also have medical assistant master's program and a few other programs where we have basically bundled different products that we have. So you can go check out those programs if you're interested in doing more than one certification at the same time. When it comes to admission process, you can schedule a call with admission advisors, discuss the bootcamp details, pay the tuition, and your enrollment is complete just by doing that, and you can start with your course the next day. In order to start the course, you get the orientation session done by the student services team, and they will assist you with everything regarding your platform, your ebooks and everything, and all the questions can be answered by the student services team as well. If you stick around till the end of the session, we have the links for you to schedule the call or send an email. As part of this webinar, and for becoming part of this webinar, we offer you a very good discount, which will be sent to you in your emails after the webinar is done. And you can take benefit of that as soon as possible. Financing options. So we have different financing options available, starting off with upfront payments. The cost the tuition that I have shared with you guys for all of the programs is not the payment if you are paying upfront. So if you pay upfront, you get a very good discount. Then we have monthly installment options, which are available through our financing partners like Fortify, Edley, Selime, and you pay them over the course of the bootcamp. Then we have Study Now, Pay Later option, which is available through Affirm. I'm sure you guys are familiar with Affirm. You can talk to the admissions advisors to review your eligibility for Affirm. Then we have MICA, which is Military Education Benefits. Eligible students may apply for the military funding towards the cost of their boot camps. And then we have WIOBA, which is Workforce Innovation Opportunity Act. And I have my team member, Chester, who will be speaking about Workforce Innovation Opportunity Act opportunities. And he'll be sharing more details about those with you guys. So I will give it over to Chester. Chester, over to you.
All right. Didn't want to come off mute, Danish. I guess it was trying to stall me out over here. Right. Hello, everyone. I'm Chester Middlebrooks. I am the Senior Regional Development Manager with Health Tech Academy. And I want to speak with you briefly about the Workforce Innovation Opportunity Act. So the Workforce Investment Opportunity Act is available in all of the states in the U.S. It's a federal program through the Department of Labor that's administered to the states, and each state gets a different amount based upon their population and sometimes their needs. Sometimes states can request more and get more. It's just a lengthy process, but it's administered through the local workforce office or American Job Center or Job One location, depending on which state. They have different names for them. But it's basically like, they used to be called the unemployment office, but in most states, unemployment has been separated. But it's basically like the unemployment office or what have you. So the process can vary from as little as 2 weeks to sometimes maybe 2 months. It just depends on the actual state and how long, how much of a need they have as far as it being backed up. Although if you're unemployed or underemployed, And what they consider underemployed is $37,250 per annum per year. Um, for an adult that has one child, and or if you're like receiving SNAP benefits, which is food stamps, or any type of government assistance, Medicare, Medicaid, you would be a great candidate and a great fit for the program. Or if you're on unemployment or not working at all, the workforce will then at that point take you through an orientation, get you enrolled into the WIOA program, and we're a participating school in a lot of states. And so they would pay us directly. There wouldn't be a loan. There wouldn't be any financial commitment on your end. Your commitment will simply be to attend the 16 to 20 hours per week, study, pass your certification, and then we have a very talented team of career services individuals because of the partnerships that we've already created with some of the medical facilities and businesses. They then will help you get a job placed locally. And that's why Donish was saying that we have a 100% employment rate. For those who have passed their actual certification, that means they sat, finished, passed the practice exam, took the regular exam, and passed that one. 100% of those have been placed within respect to their actual field in the medical field, rather, allied healthcare. So what I would do, I'll put my email address and my phone number in the chat. I've got a new number in my office. Let me put that in there. And each state sometimes can be a little bit different as far as the way you approach it. But here's my number right here. But you could definitely get approved for that grant. They pay us directly. You don't have to get involved with any of the financial things. We just have to set up everything with that particular location and get you funded. Once they get you funded, then we enroll you into the program. And then all of the career placement assistance that he mentioned, like as far as mock interviews, um, resume preparation, and LinkedIn preparation as well will be included because we're going to try to remove every barrier that we can in order to get you employed into the allied healthcare field. Just to briefly add on to the allied healthcare field, the field itself is a continual field for growth. Um, After the pandemic, there's been a lot of federal funding that was dropped in the buckets, and the states aren't giving that stuff back. So some of the states are still spending through some of that funding. Um, so there's oh, good Lord, there's a huge need for that for the allied healthcare groups and a lot of medical professions because a lot of people were displaced during COVID. And so now the medical facilities are trying to restaff those particular positions that they lost. Now, in addition to having WIOA funding, there's also some funding that goes along with it for people or youth who are between the age of 16 to 24 um, and have some disabilities or some difficulties attaining a full-time in-demand career opportunity. If you have Native American blood in you, 20% or higher, and you have a CIB card, a Certificate of Indian Blood, please let me know because we also have grant funding that is actually very fast to get funded in a few states. Also, if you have a disability, like a medical disability, like say you have chronic asthma, something that you're going to have to deal with for the rest of your life, the workforce offices kind of next to the WIOA program have funding for state vocational rehab in most states. And those will also fund the complete program 100%. So that's my phone number there, and I'm going to also put my email address in. So let me know if you have any questions about the WIOA program, the Native American funding, the disability or state vocational rehab funding, any of the above. And I will do whatever I can to connect you with that funding and to get you into one of our programs.
All right. Thank you so much, Chester.
No
So I have Chester's email and contact number. He also shared in the chat as well. But if you guys just want to take a screenshot, please feel free to do so. So we have a question about the recording of this webinar. Yes, these webinars are recorded and they are going to be available on our YouTube page. And you can get in touch with our team members and they can share the link with you as well. All right. Perfect. So these were all the payment options that we have. And now we will move on to our career services. So As you guys can imagine, with the kind of demand that is there in the allied healthcare space, the career services part is very, very important. And we are here to assist you with that part. But we want you to understand that every student comes with different kind of background, different kind of experiences. So we can never claim nor promise that we will hand you the fish. We can't do that. We can't guarantee a placement. We can't guarantee an externship placements. What we can guarantee is all the support that we can offer, all the time and all the help that we can offer. We will offer that in order to make the process as smooth and seamless for you guys. So we will help you kind of catch your first fish, and then you can repeat that entire process until the time you find your first job. And we will also have the network of peers, alumni, and our team, of course, will be there. The coaches will be there to give you as much support, as much guidance as possible. As part of our career services, there are different sport options that are available. So you have two one-on-one career advising sessions that you are eligible to get. These are different from your coaching sessions. So your coaching sessions are focused on the field, or they're focused on the content that you're studying, but your career advising sessions are focused on your career, your professional development, where they will help you with your resume, with your LinkedIn profile, cover letters, everything that you need in order to apply for different roles. So that's what those career advising sessions are going to do. You are eligible to schedule your first career advising sessions once you are done with the 50% of your course progress, and then the second one once you're done with all of your course, 100% of your course. In terms of tools, we have a career prep course that is there at the end of each program. We also have professional profile building activities that are designed for you guys so you can stand out with the employers. And we also have some of the communication assets that we have prepared for you, which can help you reach out to the employers. You can use those emails, or you can use those scripts of the calls that you can use to reach out to the employers as well. And if you ever get a chance to speak to an employer, or you have an interview scheduled, we can also do some kind of practice or a mock interview just to help you and make sure that you're ready for your interview. So that's the career services support that is available. And now we will move on to the next part of our webinar, which is testimonials. So here you can see some of our testimonials from Trustpilot. Our current rating on Trustpilot is 4.7 out of 5, which is pretty promising. And we are also going to share with you guys a few testimonials from our students where they talked about the experience. And I'm just going to share the sound so you guys can hear it. Chester and Ron, let me know when you guys can hear the sound. So I'll start with Dominic's testimonial. You guys couldn't hear it. I can't hear it either. Wait a second, let me see.
My name is Efta Deshwathobi. I currently live in Miami, Florida. My aim is to do surgical tech, and I was able to find that out through Health Tech Academy through a referral of my sister, which we both signed up at the same time, and I'm pretty glad that she did because of the help with Health Tech Academy, with the fact that it is accredited with NCCT, which was an important factor into signing up and getting the help that I was able to receive from the career coaches, from the teachers, the professors, things like of that nature has been instrumental in the success rate of being able to work in a hospital. Looking for accelerated programs, Health Tech actually were able to pop up again. It was a referral, but she had to do the research, and from there, that's when she found out it was accredited through NCCT. When going through this, I definitely looked into it. I did my research and I asked plenty of questions. Don't be afraid to ask questions. And that's what made me feel comfortable. They are on top of it. Please do the work. If you really want this, just do the work. Know that you want it and just ask a bunch of questions. They are more than happy to help.
So just in the interest of time, I'm just going to move on to, oh, wow. Yeah, I'm just going to move on to another testimonial that we can listen to, and we will end the testimonial section with that.
My name is Alex Gomez. I'm from Indianapolis, however, I'm currently studying abroad in Australia. I came to know Health Tech Academy after thorough research, and I chose Health Tech Academy because I wanted to be able to travel and enjoy my summer. I am working towards my goal of PA school, and I found this to be the best solution by far. My journey with Health Tech Academy was really simple. I was able to work and learn on a weekly basis whenever I wanted, and there was always people to meet with online to help me if I needed. Overall, I highly recommend Health Tech Academy to anybody who wants to learn. It was challenging, but the feeling of finishing and accomplishing my CMA was unmatched.
All right. Perfect. So these were a few testimonials that we had for you guys, and that brings us to the end of our webinar. I don't think we have the Black Friday sales anymore. Right, Ron? I think we forgot to remove the slide. Right, Ron? Can you confirm that? But we can wrap up the webinar with the question answer session now. So the floor is open. I'm here, Chester is here. Any questions about the program, the experience, anything that you would like to ask, we are here to answer. So we do have a few discounts that I know are live for the end of year sales. So I am sure that you guys will receive emails regarding that. And with that, you can reach out to our team using these QR codes that you see on the screen. We have this website QR code that you can use to go to our website. You can talk to our admissions team by scanning this QR code and schedule some time with them. You can also text them or email them using the details that are written here. And if you're confused about which program you should be going for, we have a career assessment quiz that can suggest you which program might be relevant for you. So you can absolutely take that, take a screenshot, complete that assessment, and we will be in touch with you once you're done with this assessment. It's a very short 2 minutes quiz, but it would absolutely help you with making that final decision about the program that you should be going for. All right, then. I think I don't see any of the questions, which probably means that you guys are all fine and no questions are there. So thank you so much, everyone, once again, for taking out the time. It was really nice talking to all of you, and I hope to see you guys on the other side as one of our students. And if you need any more information, please don't hesitate to reach out to us, reach out to the admissions team. And if you want to reach out to me, you can read my name over here. And you can email me at danish.khan@healthtechacademy.org, and I'll be there to assist you with everything. I think somebody said check the chat. Yeah, so Chester just shared his email again. Have you gotten that now? Because I think he shared it earlier as well. You might have missed it then. Have you gotten it now? It's chester.middlebrooks. Okay. Perfect. Perfect. Thank you so much. All right, guys. Thank you so. Oh, you didn't. Okay, so you're at work. I'm trying to listen in. Okay. So it's chester.middlebrooks@healthtechacademy.org. So I think you should be able to get it now. Can you type it, lol? We did type it. Let me type it myself as well. Okay. I think Chester, you probably, yeah, for some reason it is only sending the messages to us. It's not sending it to the public. Let me check that. Ron, are you there? Okay, I've just typed it in the in the question answer feature. Can you check it now? I think that should work. Perfect. Thanks, Ron. Thanks for doing that. And somebody said that they missed a lot of the part. You can absolutely listen to the recording. It will be sent to you guys. And if you don't send it to you guys, it will be available on our YouTube channel and on LinkedIn as well. So feel free to refer to it. And if you have any further questions, reach out to me or you can reach out to the admissions team as the email is listed here. And if nothing works, you can absolutely go to our website and you will see different contact details for different departments at HTA, and you can reach out to them and everybody will be there to assist you in every possible way. Thank you so much, everyone, once again. And I wish you best of luck for your upcoming allied healthcare training journey. Take care, everyone. Bye-bye.